Hey everyone, I'm Dr. Matt Geller. I'm here with Dr. Gettinger, who practices in St. Louis. Thanks so much for coming on.
Thanks for having me.
So we're fortunate enough to be sitting here at the Johnson & Johnson Vision booth, and they have their whole AccuView Oasis family of products, Oasis 1 Day, Oasis 2 Week, AccuView Oasis with Transition, so there's lots of options out there. How do you drill down and find what's right for the patient?
Sure, and that's one of the reasons I love AccuView is because they have a wide amount of lenses to offer to patients with a lot of parameters. So obviously prescription comes into play. Again, the modality I usually pick based on what the patient is wishing to get out of the lens, but also what I think they would do best with. The Oasis with Transition is great. I've had people actually come in to my office specifically for that reason to be refit into it. I've had a lot of success with it so far.
It's a good practice builder, it sounds
yeah,
like.
it's a great practice builder, and it's got a lot of buzz. People are hearing about it, they want it. But yeah, it's mostly based on what the patient wants and what I think they would be best fit for overall. And AccuView luckily has a lot of options for me, so a lot of times it's just kind of picking which one of their family is going to be the right fit for a patient.
Yeah, it keeps it simple because in your mind, the nomenclature is the same, things are standardized, patients get the brand, there's great marketing behind it, so it just becomes easier, more turnkey, keeping up with the pace of today's patient care. It's kind of nice to have.
Exactly, and AccuView Oasis has been around for a very long time, and that is probably the one lens more often than any other that I have patients coming in and saying, this is the lens I've heard about and I want.
Sure.
And which is kind of reassuring because I can then be like, yes, I like that lens, let's fit you in it.
Yeah. What are some of your go-to lenses for new patients and why?
Sure, so a lot of times I base it on what the patient is looking to get out of the lenses. The AccuView family of contacts, they have a lot to choose from, so a lot of times I'll grab them. If I have a patient who's looking to wear their lenses only for special occasions like sports, weddings, daily disposables are a great option for them. They're by far the healthiest, most comfortable lenses. Really good patient compliance too, nothing to think about, put it in, throw it away. No solutions to worry about. But yeah, it's usually a great fit for new wearers, and sometimes I'll even refit people who have been in a monthly or 2-week lens into daily disposables because they're great for vacation too. You don't have to bring solution along on a plane or drive airplane rides anyway. Daily disposables, gonna be a good fit. But if it's somebody who's really wanting to wear their lenses every day of the week, then sometimes I'll go for a 2-week or a monthly lens just based on cost, but also for new wearers it's a lot easier to handle sometimes because they're a little thicker. But most of the time I base it on the parameters of their eye and then also just what they're trying to get out of it. If they're dry, I try to fit for a lens that's better for drier eyes, but it just kind of goes based on them and my own personal opinion.
So let's talk about strategies to kind of fit and retain new contact lens wearers, right? What comes to mind when you're thinking about that topic?
Sure, so a lot of times with new contact lens wearers, first of all you have to start with somebody who's motivated, not the parent who's trying to push their kids into it, so motivation helps a lot, but also just setting patient expectations and really sitting down and talking with them to figure out what do they want from the lens. And that comes into play a lot for me, picking the lens that's going to be right for them, because a lot of times picking the right lens is what's going to ensure success.
How much contact lens dropout could have been avoided by kind of starting with that goal in mind and setting expectations to begin with, you think?
I think a lot. I think that's probably the number one reason I get contact lens dropout is because their expectations weren't set correctly to begin with. The second most is probably just because they're just not motivated enough, like they just decide that it's easier to throw on their glasses in the morning and they're not willing to get over that hump of practicing enough getting the lenses in and out that it becomes a easy task. So a lot of times it just comes down to them saying, it's just taking too long. It's not usually about the lens comfort or the vision. It's usually just the patient themselves just choosing glasses instead of contacts. And I think that usually is because we talk a lot about this is what you're going to expect. If you're in a multifocal, don't expect to drive at night in them for long distances, things like that. So they really know what they're getting into and not just reading things on the internet and coming in with very bizarre notions of what this lens can accomplish for them.
It sounds like there's a big human element to this, whether it's the doctor or the staff. The proper time needs to be put in, both to educate in the beginning, practice and application and removal. Any notes on that or tips around that?
Yeah, I think it's important as a doctor, even if you're having the staff do the insertion and training, I think you should pop in every now and then, especially have an eye on the watch. If it's taking a while, you might need to pop in and kind of see what's going on, because no matter how well trained your staff is, we've all kind of gone through a lot more training than them. So sometimes you can see something that's just like a little tweak And a lot of times too, it's just reassuring for the patient to realize that you're also like rooting for them, you're behind them.
There's a big psychological component, I think, to the doctor being there.
Yes, optometry is a lot more psychology than people give it credit for.
Yeah. At what point does price become a consideration?
Always, because you're dealing with a consumer. And so a lot of times that is always in the back of my head. And I do try to talk with patients and let them know generally price ranges of things, ballpark figures. But a lot of times I'll make my suggestion to them before we even talk about price. If somebody is wanting to wear the lenses every single day and they express interest in a daily disposable, or I think they should be in a daily disposable, I usually will say, hey, this is a more expensive option, but really this is what's going to be better for you. It may not be the most cost effective, but in the long run you're not going to be happy with anything else. And this is just professionally what I think you're going to be the best in.
Just to try a daily disposable is probably a great way to get them into the lens. Do you ever do that sort of thing?
Yeah, I love to give patients trials where they can kind of put them to the challenge themselves. So usually I'll give them the daily disposable lens that I think they would do best with. And then I'll also give them a lens that maybe isn't the most ideal lens, but is more in the price range that they're kind of thinking of. So then they can actually compare them themselves out in the real world. And 9 times out of 10, they'll come back and say, it's worth the money, I'll go with the daily lens.
Yep.
You were right all along, Dr. Kate. And then I'm thrilled,
Yep.
and they're my patient for life.
There you go. Yeah, I've had done that as well, and it definitely works. So for new wearers and daily disposables, are there certain brands you aim for and why?
I definitely tend to grab a lot of the AccuView family of lenses. I love the One Day Moist, especially the astigmatism one. It comes in a little bit higher astigmatism parameters in the fitting set, which is very helpful.
What do you think are the biggest challenges for new contact lens wearers?
Compliance, a lot of times, is a big one. Just figuring out how they can treat the lenses. You throw a lot at people when they first start wearing contacts. I mean, it's a lot of information to take in, and sometimes, I mean, with adults, even it's a lot of information, but a lot of times you're training kids who aren't used to being thrown all these like responsibilities all at once. Mm-hmm. So just keeping track of like, what's my wear time on this lens? What solution am I storing it in? How many days a week can I wear this? When do I replace it? So a lot of times it's just kind of maintaining all that information you just put in front of them and making sure they're going off on the right foot and not getting stumbled along the way.
What do you think are the top 3 reasons, at least at your practices, why your patients or why you've seen maybe patients from other doctors dropping out of contact lenses?
Probably, like I said, the big one is just patients who maybe were rushed into a different lens than what was properly for them. I get a lot of dry eye patients, and personally as a dry eye sufferer, I have a very soft spot for them. And I know sometimes that you have to play a little bit with people and figure out which lens is going to be most comfortable for them. So sometimes it's a matter of giving the patient what they want, but also knowing as a doctor what's really going to be best for them.
We all know the health benefits, and there's a long list of benefits to daily disposable lenses, but a lot of patients aren't there yet. They're not ready for it. If you know that that's your end goal, which lens do you start them in to ultimately get them there?
Yeah, usually then I'll grab for a 2-week disposable lens. Usually it's a lot more comfortable for the patient, and it is encouraging a more rapid replacement schedule than a monthly, but it's usually more cost effective for the patient as well. So a lot of times I get better comfort, better clarity, better patient compliance, and patient acceptance if I try a 2-week lens rather than just going for a monthly and trying to make the jump from a monthly to a daily. It's a little bit more of a drastic jump, but the 2-week is a nice in-between for them.
So if we could just give our patients a little bit more education or some tips on when to replace their lenses, how to do reminders properly, any hacks or tips there that other ODs can utilize when they're in the exam lane for their patients?
Yeah, so one of the big ones I do is I always give patients information when they leave, kind of stressing this is when you need to replace your lenses, whether it's a 2-week or a daily disposable or a monthly. Also, it's really a good idea if you can get the patient to buy a year's supply of contacts. I find that they have a lot better compliance because when you have the product, you'll actually wear it and use it. A lot of people will try to get only what their insurance covers, or they'll get a 6-month supply, but a lot of times they'll come back and call maybe 8 or 9 months later rather than after 6 months. So if you can really get them to go for the year supply, that tends to be better for compliance, and sometimes it's just a matter of saying, look, you get a discount if you buy the year supply. You're not going to have to hassle with calling us and ordering more.
Yep.
You'll just do it at your regular annual eye exam.
Yep.
But yeah, it's just a lot about keeping patients educated, but also encouraging them to do the right thing.
Some really solid tips. Hopefully everyone out there learned something new. Thank you so much for coming on.
Thanks for having me.